I'm Dr. Kathleen Stephany. I'm a nurse and a psychologist and an ethicist. And I'm the author of the textbook, The Ethic of Care, A Moral Compass for Canadian Nursing Practice. I'm really excited about this textbook. It's a work from my heart. I have researched it and also apply the principles in it in practice with my students. First of all, the ethic of care has been around for greater than 30 years. It's a very important aspect to nursing practice because traditionally ethics has been approached from a rule-oriented fashion, and nursing is a little bit different than other professions in the healthcare system. Nurses spend the most time with patients. They're there 24 hours a day in a hospital setting, and even in a community setting, they spend a lot of time with patients. And therefore, they need to have a moral guide that teaches them to care for patients in a holistic manner. With the ethic of care, the person is center. What matters to them is important. What matters to their family is important. And relationships are important. A really central theme to the textbook has to do with unconditional positive regard, which means caring for people regardless of the decisions they have made or the choices that they have made. Another really important piece of the ethic of care has to do with advocacy. Advocacy is about being the voice of people who have no voice. And so often when people are ill, whether it be physically, emotionally, or psychologically, they feel disempowered. And that's where nursing advocacy becomes extremely important, where the nurse will have that relationship with the person and be able to say, hey, I will be the one who will approach the physician or the decision makers and let them know what it is you really want. I talk about embracing diversity. And when I talk about embracing diversity, it's about embracing what we have in common as human beings, but it's also about embracing what is different about us. The nurse has to be aware of his or her inherent values so they don't impose their values on the people they care for. But we live in a very complex culture, especially here in Canada. Canada is one of the most wonderful places to be living in, but we also still have discrimination in this society, and this ethic of care advocates for nurses to be instrumental in ending all discrimination.